Uh, Hello, students. We are bringing to you Arthroplasty series. In the first series, we will do a knee arthroplasty course. And in this, not only we will discuss detail of steps of doing a knee replacement, but we will start from very beginning. We will first tell you what exactly is happening in the world of osteoarthritis in terms of etiology and pathology, how we developing new medicine to treat osteoarthritis, and doing with disease modifying medication rather than simple analgesic and anti-inflammatory. And then we will progress to see that if conservative treatment failed, then what are the options available for you. We will discuss osteotomies, we will discuss unicompartment knee replacement, we will discuss total knee replacement. We will not only tell you stepwise how to do a good knee replacement, but we'll also tell you the principle and goal you want to achieve and how you can achieve that goal by doing a proper exposure, by doing a proper soft tissue releases and doing a proper bony cuts, so that you get a perfect knee replacement, or at least hope for perfect knee replacement in most of the cases. We will also discuss the possible complication and how to deal with this. And I hope this course will be very useful for you, not only for your exam to answer these questions, but also for those people who are beginning to do knee replacements. So I am hoping that most of you will attend this course this coming Saturday. And we have got a fantastic faculty nationally and internationally to discuss all these topics for you. Thank you very much.